What's up, guys? Look, I know a lot of folks come to the channel, they're looking for advice to try to help stop Suboxone, Subutex, buprenorphine, etc. They've been on medication assistance for years, and they're ready to kind of take that next step on either tapering down their dose or coming completely off. And so I want to talk about that a little bit, but before we get, this is the caveat, and I've said it before. Just because you're on medication, man, don't feel guilty for it. Medication assistance saves lives, and not everybody is at the point where they need to be tapering or even thinking about that. They need to just be focusing on other things, you know what I mean? Staying sober, staying clean, working on their life in other aspects, okay? So always talk to your doctor before trying to stop your meds, come off your meds, whatever, okay? So, but if you are at the point where you're ready, you know what I mean? Like you're ready to start tapering, you're ready to even be able to think about being off medicines. Because I have some patients who they're tapering, but from a psychological standpoint, it kind of freaks them out to think about not being on meds at all. And so what we just try to do is focus on reducing the dose slowly over time and not even thinking about stopping, just thinking about, okay, what's the next step to reduce the dose to the lowest effective dose? You know what I'm saying? But let's say, you're past that point, you're ready, you're ready to be off medications. And there's some things you need to consider. And one of those things, and this might be, I'm not gonna say it's the most important thing to consider, but it's up there, right? It's post-acute withdrawal syndrome, and or PAWS, as is often called, and that is it hits people differently. Not everybody has it, but some people definitely feel it worse than others, and it can be difficult. It can feel like a severe depression. It can come with severe fatigue. It may just like be intermittent, where it comes and goes, where you almost feel like you have withdrawal for a few days and then it goes away and then it comes back. You might have some restless legs. You might, there's some different elements to this post-acute withdrawal that you can have. And so I want you to kind of start planning and preparing. How are you going to handle that, if it happens to you? And a little bit, I'm a little hesitant to bring up the topic, because I don't want you like so focused or so worried about it that you wouldn't, take the next step if you're needing to. I don't know, does that make sense? Like, sometimes when we start worrying something's gonna happen, we almost like wish it into existence, you know what I mean? So just be careful with that. Like, I'm not trying to get you to panic or have anxiety over it, but I just want it. We need to start putting in a plan, especially if you're in the tapering process and like you've got this idea, okay, I'm going to be off meds at this point in time or whatever. You need to have a plan in place just in case you deal with this. And obviously the first step is you talk to your doctor, and then you start to think, okay, if I have these symptoms, what am I going to do? But the best thing you can do is to prepare your body and your mind to cope with this when it hits you, okay? And one of the top things you can do is make sure you're exercising, make sure you're eating healthy foods, make sure, your metabolism is good, make sure you're healthy in other ways, like you got a good blood pressure, you're not, you got if you have diabetes, that's controlled, your hypertension, make sure you're not, having severe issues with your bipolar, you're not manic all the time, make sure you're sleeping good. You want to adjust, adjust is not the right word, but you want to really dial these things in, so that you're doing everything you can to have a solid foundation to be able to deal with any problems that might arise once you're off medicines, right? Because what's the ultimate goal? The ultimate goal is that we don't relapse. The ultimate goal is that we have a nice, fulfilled life, And something I want you to also think about is that, look, I think people have this false idea that when they're off medication, like that's the only thing lacking in their life, But I'm here to tell you, if you're not happy now, you're probably not going to be happy when you come off meds. In other words, your happiness doesn't depend on that situation, right? I mean, I would say if you're like an active addict, and you're unhappy, then yeah, you know, getting off drugs is the first step, right? But there's a lot of people who come off drugs and they're still depressed. They still have a lot of anxiety issues and other problems, you know? So my point is, you're not going to just like, reaching that goal, as awesome as it is, it's not going to just automatically put you in a place where your life is perfect. And I think you know that, but I think there's oftentimes a false idea of what is going to make you successful and happy. And so I would encourage you to think about that right now, that, okay, just because I hit this goal, that will be good. You know, setting goals and hitting goals are good, but that's not going to complete you, right? You know what I mean? That's not going to make you whole or whatever. And you're going to have to deal with that. It's sort of like if you set some kind of goal for yourself, maybe it's financial, maybe, you know, with your job or with like a raise or trying to get a certain, you know, position at work, or maybe it's like you've been running, maybe you're a runner and like, you're like, if I could just get, you know, my 5K or 10K time down to this, you know, that's your goal, right? And then you hit it and you find yourself not fulfilled. Like, you know, I mean, it's a good thing and it makes you happy, but it's not, it doesn't complete you. You know what I mean? Like now you're looking for the next goal, the next step. And so that's going to be similar to this. You're going to feel good about it, but there's going to be more needed. And so you need to work on that now, because if you're not happy now, you won't be happy later. So always focus on now and preparing for the future. Okay. All right, guys, that's all for today. I hope y'all have a great day. Peace.